Hi,
Sorry,
Christina.
the wrong link. I'm sorry.
All good. Sorry, that's probably my bad. I had a different link originally. There was a bit of two links, a bit of a mix up, but here we are. We've made it and so forth. So
Good to see you.
thank you, for everyone on the line. And then, of course, we're recording this and sending this out to the broader group as well. We're so honored to have you. Dr. Bove is a cardiologist and preventative health physician, and also does all the protocols for 100 Health, which we're proud to say is our testing partner for all the Beusail longevity forms. And you just serve as a beautiful bridge between, I would say, health data, AI, and personalized medicine. This is, of course, the topic that we want to bring up and everything around data. And I almost want to say sometimes we get a bit of data of overwhelm, right? Like, kind
Yeah.
of where can we start or where do we start? And then once we have great data, where do we go from there? And then, of course, on the cardiology side of things, I mean, if that's your specialty, so I would love to touch on some of those topics as well. And of course, bring in any Q&A and questions from the group. In general, we have a whole mix of people. We have people that are brand new to our Beusail longevity forums. We have people that have been a part of our forums, and then we have people who are curious about becoming a part of the family here when it comes to longevity. So we've got a real great mix of people. And I will stop sharing so we can all see each other in a little bit more of a easier way. And again, welcome.
Yay. I'm excited to be here. Thanks.
Amazing. I thought, since this came up in our intro call a couple weeks back, before we get into the crux of the material, I thought it'd be great for you to share a ritual that you have, which is hanging out on a surfboard, doing a little bit of meditation, and being in the ocean. Like, tell us what that's all about. And I just love the fact that this practice, is kind of a fundamental when it comes to longevity, and this is kind of testing and whatnot aside.
Yes, so that's something that evolved. I can get into my background in a little bit, but I
Please.
previously, had my own private practice, and even before that was in, 25-person cardiology group as the only woman working, crazy hours and, realizing early on that quality of life is important for both just my sanity, my family, but my health too. So I think I realized that early on. And so that's partly why I ended up leaving kind of the big corporate medicine type of position and going into what I did, which was a small, private practice. I opened my own practice back in 2003. And that evolved. But one of the big things was just always I've always had a dream of learning to surf and also living part time in a Latin American country because I'm half Latin and always felt kind of just at home. So that kind of evolved into us deciding once we were able to make that come true. So we did that probably 5 years ago. So I'm
Love
a
it.
old a novice beginner surfer starting late in their 50s.
You're still in your prime. Come on now. Especially in this group.
Old for a surfer though.
I love it. I love
Yeah.
it. And what about the meditation? What does meditation look like, either during or prior to the
Always
surfing?
prior. I
Okay.
think I mentioned I surfed with a group of women in Mexico, and they're very much into kind of mind body, and so we always meditate first. And I think even just I've always had my own way of doing that without formally doing that, where just having my feet in the sand and hearing the waves and being able to just kind of calm everything else down and really just focus on nothing.
Mm,
Um, I think it was always something I just gravitated to, and the ocean because of that. I think the ocean just, has that energy and just draws you in. So I think that's just something that, I miss when I don't have my feet in the sand and can just sit down and hear the waves. So that's like the perfect end to a day. And I've always joked because
I
it's a
agree.
perfect lower your cortisol.
Yes, I agree. And there's always a version. We all have a version of that, even if we're
Yeah,
not. I mean, I'm not on the ocean, but I have one of the Great Lakes nearby. But even just getting outside and planting your
yeah,
feet in some grass if you can, right? And getting some sunlight is half the battle, really.
yeah. No,
So. And how did you, so we just so we can get into some of the testing and a little bit more into the nuance of how we can look at some of this data and so forth. How did you get involved with 100 Health and why are you involved with that incredible team?
So, I kind of come, I guess, from a unique background because I'm a traditional trained cardiologist and had was in private practice, doing hospital work and private practice for a long time, and then went in a different direction. So, which is unusual that I have kind of both sides. So I ended up around 2015 going into more of a functional cardiology, functional medicine side. Started out really with weight loss, and at that time I was just kind of a light bulb went on, and I realized, to be honest, that I wasn't helping patients. Like I really truly realized that we were putting stents in patients. We weren't lowering cardiac disease at all we were doing was smushing plaque against their walls. And that's what patients didn't understand is, they just wanted a pill to like get better. And we were, putting them on statins, putting them on blood pressure medicine, treating their diabetes, but we weren't lowering the incidence of disease. And I became interested in, how I could help. And somehow I just was at a meeting and it started off with just like learning about a ketogenic diet back when it wasn't popular. And I decided, hey, I'm going to start a weight loss program for my patients because I think they'll benefit. And I did it on my own, outside the practice, and worked long hours and did coaching. Eventually hired a coach, but did the coaching myself. And it was a journey. And I realized I'm actually fixing people now, which like I was not doing before. I was just putting band-aids on. And so I became intrigued. And from there, I learned about hormones and more functional medicine. And then slowly, decided, I bit the bullet and said, I'm going outside the insurance model because that really isn't serving me or my patients well. And just practicing more of a wellness preventative medicine with the cardiology and longevity side. So that I went ahead and did training in longevity as well as hormones and peptides and did that for several years and then decided to do just more consultant work. So I sold my practice and I met Tyler actually through one of the concierge groups, longevity concierge groups I was consulting for at the time. And we connected and just, I think I heard what he was doing and we talked offline and it really excited me. And I just said, you know what, like when he asked if I'd want to be involved, I was like honored to jump in because I think they have a great team and I'm excited for what they're doing because I think it really doesn't exist right now.
Yeah.
So we're building something that hopefully will help. And one of the things too that he focuses on, I think, is that there's lots of concierge and longevity concierge practices. But there's a few things with that. Number one, I don't think any of them, and I've been a part of a lot of them, do a good job at simplifying data. And sometimes they make it more confusing because they just approach everything like a shotgun approach. And next thing you know, you're on, thousands of dollars of peptides a month. And like, you're not necessarily better because we didn't
Sure.
like focus on the basics. And I think 100 is trying to separate themselves with that because they're helping people out with the data. So they're providing all the data that you normally can get now on your own, but you're lost kind of. And kind of with the AI integration, we're really able to kind of hone down and not just hand people data, but really help walk them through it and make it kind of in bite-sized pieces so
Hmm.
that they know where to start and what their priorities should be. And it's all in one place so that we can, integrate the wearables and the medical records and the biomarkers. And so everything is there, which is really unique and I've never had before.
Yeah, the medical records was, I mean, Curtis was showing me this a couple of weeks ago. We were all together and he was showing me his import of his medical records, and that's pretty impressive, right? Like talk about having everything in kind of one spot, and then, you're not hunting for things and then you can get real focused. And even our objective, we have another form starting next month. We'll be focusing on taking the 100 data, which is for anyone that hasn't experienced that. And essentially, you're giving a blood sample and so forth, and running. It's well over 100 biomarkers at this point, and you're getting a 100-day protocol back that's personalized to you to focus on. These are in range, out of range. Here are some movement nutrition plus supplements that can help those in those areas. And then we want to actually, as a group, focus on like what are the top three biomarkers or areas
Right.
of health that you really want to focus on, and we'll leverage the group and speakers and so forth to go a little bit deeper.
No, and I think that the AI integration is key. And I think, I hear varying views on it, but my personal belief is that physicians will still be around in 5, 10 years. It's funny, I have a son that just graduated from college this week, and he's
Oh,
pre-med
congrats.
and planning to apply to medical school. And I almost discouraged him for a while because I basically wanted him to know, what you think you're going to have. His father's a primary care doctor, internal medicine, and that's what he thinks he wants to do. And I said, what you think you want to do isn't going to exist in 10 years. Like, it literally isn't going to exist the same. And you have to at least be ready for that and be willing, because a lot of kids, like in his position, are very young and idealistic, and really they're anti-AI.
Mm,
It's kind of funny, but I've told him, I think that if you don't accept it and go with it, you're not gonna you're not gonna be part of the future, and
yeah,
that the best outcome is to be able to work with it, but not have it replace us. And
yeah,
I see that every day reviewing protocols, that it's way better than me. I don't know every supplement interaction in the world, or that this berberine, you can't take this with this SSRI the person's on, or this seizure medicine they're on. And so we get a lot of things like that, but also just things that I wouldn't have thought of. So, they'll pull in the medical history and realize that, yes, we shouldn't be telling this person to do CrossFit because they have, bilateral shoulder injuries and a knee replacement. So
hmm
it really brings everything together. And it looks at, their stress scores and, everything. They're obese, and they're not only working out once a week. So we really shouldn't, give them 4 exercises to do, 3 times a week, because they're not going to do that. It's going to be overwhelming. So I think it's a really good joining of personalized medicine and AI together.
yeah. Well, and that's something too, even on my side when we were speaking. I mean, I think it's easy, especially like you're in the app and you get your protocol, and obviously we know there's a bunch of AI involved, but not to forget that literally your eyes
Right.
and perhaps other people in the team as well have gone through those protocols, right? They're we're looking at the person that actually goes
Well, it's
through
the
it as
same.
well, right?
We all know that AI sometimes messes up too. So that,
Yeah,
we'll recommend in top 3 supplements something that doesn't make sense. And so we have human eyes on everything, saying, this doesn't make sense. They've created a new version that will eventually be available to everybody, where you can chat with your protocol and ask it anything. So I can do
mm,
that with my admin side, and I can say, hey, why did you do this? Tell me
oh,
why you
interesting.
did this, psyllium or whatever, because I would have done this, or at least from what I thought I would have done. And either it corrects me, or sometimes it says, hey, that's a really good question, and it'll go through and pull all the data for everything, and then at the end of the day it'll say, like, I was wrong, you were right, occasionally. So but
Sure.
to have that interaction is just really cool. And I think the members will have that too as well. So that's a goal, is that they'll be able to look at it and say, hey, what can I do about my low heart rate variability? I'm already doing X, Y, and Z, blah blah blah.
Yeah, that's amazing. Okay, so thinking of, just because I am seeing a few of our members who have gone through the process, and even if you haven't, people that have done um, extensive testing and so forth, the thing that comes up most often, and even though 100 is doing a really good job, trying to simplify the data, it's still the questions still come up around like what do I do? Where do I go, or what do I do with this? Like outside of the obvious things, of course, but should I bring something to my family physician, or is that completely the wrong path? Do I find an integrative medicine doc? Like so I guess my question is where do you start with people when they've got data, and this is probably when you're in private practice, but like where are the starting points, I guess, or what questions can we be asking so it feels a little bit more manageable as some first steps.
Well, and I think that's unique and that's hard, because I've seen both sides of it. And I have, just this last week, I had a patient bring me, sent me on my phone, as they always do, um, a document that was, I think, Claude generated. And literally it was probably 20 pages that they had to put their genetics in. And they basically sent me, here's what Claude says you need to do. And you need to do all these tests. And these are the potential treatments I need. and it didn't take anything into account of like what actually was going on. And it was like, it was
Mm.
literally $4,000 of tests. And so I think that's where we're personalizing it more so that really AI is helping us prioritize what's most important. And then making it simpler, because I think, there are some patients that want to attack everything at once and say, I want this, 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 and this, but that, we're right now catering, I think, to the big population, which, some of these people aren't even exercising or, have very poor metabolic health and, cardiovascular markers. And so we will prioritize kind of where we see as far as risk. So kind of the big things we'll look at would be the cardiovascular risk, metabolic health, inflammation, and then nutrient status, and kind of just foundational areas like, liver, kidney things. But that we're able to, with the personalized onboarding, we're able to take into account what their goals are too, as well as kind of symptoms and, what they're already doing, and compare it. And so it's a very complicated process on the background, what's happening. But I personally think that that's needed because there's just too much data. And
Yeah.
so like when a patient brings me all that, I'm just like, that's just too much to go over in a 45-minute visit. And it's not really even applicable necessarily to you. We need to find out, are you even having symptoms of any of these things first? And are they clinically relevant? So we're in the era, I think, where there's too much data and we really need to hone down on what's important. So for me, kind of, I look at the top kind of 5 things, the cardiovascular health, the metabolic health, inflammation, which we know is aging. So aging, I guess. But
Mm.
that's, the key to almost all disease is inflammation and oxidative stress. So figuring that out, looking at hormonal balance, as well as recovery, so that the wearable data, and then kind of nutritional status. So they're kind of the basic things, I think, that like where we really want to focus. And then everything else we can kind of go from there. But that's really kind of where I'd say hone in on these top things for
Okay.
overall longevity and health.
I definitely want to get into cardiovascular blind spots, but before I do that, just again, knowing, there's a handful of people on the line that have been through 100 and various tests. Does anyone have any specific questions? Either with, whether there was confusion or, the questions around where to start or where to continue kind of thing based on what you got back?
Sure, I'll
Yeah.
ask.
Yeah. Thanks, Dave.
Yeah, there was a couple of biomarkers where it was like, hey, this is a little out of range. And that question on page, should I take this to my primary physician and start talking through options with them? Or as a part of this, like, now I've got my 100-day protocol. Is it like, you know what, let's do the protocol and then let's see how it looks. Um,
Right. So,
you
and
know,
I think it's evolving. So, we're working on a clinical side to this. So, and we're already kind of trialing it so that we're doing lab reviews with individual patients or members, and helping them beyond that. Because I do think that, it's funny because Tyler and he laughs because I always say I want more information. When we first started reviewing protocols together, he'd be like, you have to decide, Bove, like pick the supplements. And I'm just like, no, I need more information. Like, and so the goal is that, number one, there'll be a clinical side. So if it's just a one-off consult, we can do that. If it's, a hormone program, we can do that. If it's a weight loss GLP program, we can do that. But also that it's going to integrate with your phone so that, we can ask those questions that come up when I review a protocol. There's learning, like, one of the things that came up early on was we kept seeing, abnormal urinalysis. And I kept telling Tyler, like, we're not going to act on these. Like, yes, we should be asking them if they have symptoms, obviously, but that we're not going to put somebody on cranberry extract just because we saw a few white blood cells in their urine. And the protocol was recommending things like that all the time. And so we always want more information. So that's where I think the human piece comes in. And that will end up being something that, they're working on that now, how we can integrate, pop-up questions before we give you your protocol. So these are the questions that the provider would normally be asking you when you met with them after your labs. And so that's going to be hopefully soon, where it dives in further. So we don't need to give you a 20-page onboarding, but we can, after your labs, kind of get extra information and see, because there are things that should be followed up. And so, we want more questions. And, we have people that, didn't know they had liver disease. So, they do need to take that on further somewhere else.
Yeah. Thanks.
Thanks, Dave. Yeah, we've experienced that in our group as well, where someone, really had no idea, they had some cardio concerns, and that led to a referral and other tests and so forth. And now he's on top of that situation. So where we had no idea, prior to.
Yeah. Our goal is really to just more educate people too, so that they can, I think we should be able to offer the help, second stage help, but that, I think depending on where you are with your primary care doctor, there are times when, they won't even order some of these tests, which is unfortunate. That, they'll have a list because they want to see if their insurance pays. So they'll go to their primary care doctor asking for an oxidized LDL and, and an NMR, and the physician will say, no, you don't need that. And so it's hard because it's, the patient's caught in between. So the hope is that, I think, traditional medicine and the insurance-based model will catch up one day when they start seeing the better outcomes. And that's at the end of the day, it's the outcomes that matters. Reversing disease and improving cardiovascular markers and, phenoages and things like that.
Amazing. Speaking, I've heard you mention something to the fact that many people are technically fine until suddenly they're not when it comes to their cardiovascular health. So I'm wondering, what are some of the traditional blind spots in our just regular heart health screening, I guess, or questions that we should be asking or paying attention to?
So I think if we look at traditional cardiovascular screening, it's just a huge blind spot, to be honest. And it's still true today as it was 20 years ago, I think, that half of all heart attacks happen in patients with normal LDL cholesterol. But the focus has always been, up until recently, on LDL, that we need to target LDL and lower LDL as the cause of disease. And that's far from the truth. Yes, LDL plays into it, but I think you guys probably know a lot about more than the average person. But still, that in traditional cardiology, that's insurance based. They just get pings on their computer that's linked to the insurance and to the Medicare repayment and all that says, are you treating the LDL? And the person may have a normal ApoB and very low risk and has no benefit from a statin, maybe higher risk because they're ApoE4 or whatever. But that we're not focusing really on what we need to be focusing on, which is one of my passions, is just the vascular health and the system that the LDL lives in. So, the inflammation, the oxidative stress, all those things are much more important. So identifying those, because they're going to be different in each person, and then targeting those specifically. So they're just like any two protocols shouldn't be the same, even treating the same thing. Especially for cardiovascular health, there's no two protocols that really at the end of the day should be the same. And I think in medicine, we're just used to, here's the protocol for this, here's the protocol for this, liver disease, you give this. And that's not true, I don't think, for any part of medicine, but especially the heart and the vascular system, because we really want to identify, is it vascular inflammation? Is it, cortisol playing into it? And the poor sleep, that's the biggest thing. So it's really kind of deep diving into advanced markers that can kind of put us in the right direction to see where to go.
What about when it comes to plaque and reversing plaque? And first of all, is that possible? Are there some preventative kind of disease progression what does that actually look like in practice?
Yes. So actually, so I trained in my fellowship. I was one of the first cardiac CT MRI trained cardiologists that did a fellowship for that. And so I did a lot of vascular imaging during my fellowship, and I did several years of research where I was imaging, actually vessels of mice, literally on MRI, and looking at plaque and things. But early in practice, I started with, actually reviewing CIMTs myself, so carotid intima-medial thickness, for patients that were higher risk, that, I wanted to catch disease before you even had calcium, before a calcium score was positive, because we know calcified plaque is stable plaque. So with a CIMT, even though we're limited to the carotid artery, it's a big artery, so we can visualize it well with ultrasound technology, and you can see thickening, which is a precursor to plaque. And you can also see beginnings of plaque and follow it up. So I was very aggressive about detecting plaque in my patients and reversing it. And so there's a lot you can do to reverse plaque that actually even is more, has better results than putting patients on statins. Like, I'm a firm believer that statins have their place, but that not every patient needs a statin. And that, calcified plaque is stable plaque. So we want to look for soft plaque, really, and catch people early, which unfortunately, teenagers now have soft plaque in their arteries and elevated calcium scores because of, the way we live and how our diets changed, unfortunately, and the, increasing amount of overweight and obesity that there's so much higher insulin resistance, now than even 10 or 20 years ago. So that the goal was really to catch these people early so we can prevent disease, prevent events, which I've seen happen, and I've reversed plaque. So it can happen. And I think that you just need to, data is power. It can be overwhelming, but I think, you can't treat what you don't know. So some patients are afraid because they don't want to know if they have plaque, but we have ways to reverse it, and I've seen it. So,
Well, yeah, I realize everything is typically, especially in what we're speaking about today, like very personalized. But I mean, in general, is there like what are some of these, I guess, tactics that any of us, I assume there's probably no harm in trying to either reverse or prevent plaque from forming in general. But what's worked, I guess.
So I think from the basics, like, looking at even just foundational supplements that I think almost everybody should be on. I think almost everybody, there's data for omega for plaque reversal. There's data for garlic. There's data for, our diets, even the people that eat the healthiest, that eat whole foods and, organic everything. Most people don't have an optimal omega-3 index. And it's just because of the over decades, the decreased amount of omega-3 in meat that we're eating. Most of the fish is farm raised and high in omega-6s, which is like eating processed food. So, there are simple things. So I think vitamin D3 with K2 should be like foundational for almost everybody, because we know that K2 can help prevent plaque formation and, help send the calcium to the correct place, which is your bones, and not to the aortic valve or to the coronary arteries. So omega, vitamin D3, K2, I think are foundational for cardiovascular prevention. When patients have plaque, I think that nattokinase has really good data for plaque reversal, as well as supplements that help build the glycocalyx. So I don't know if you've heard of what the glycocalyx is.
No.
The glycocalyx is basically, like, I explain it to patients, it's like the Teflon lining of your artery, but it looks like little hairs. So if you look at an electron microscope, you see the little fuzzy hairs, and it should be that protects the artery, and cholesterol and LDL can just slip on by them. And lots of things disrupt that. One of them, like most things, age. Unfortunately, as we age, we get less efficient at building things back, and that's almost with every part of every organ we have. But when the glycocalyx gets less efficient, there are things that were accelerated more. So just sheer stress from high blood pressure, that's why that's a major risk. Smoking from oxidative stress or any other form of oxidative stress breaks it down. Interestingly, sugar and high carbohydrate diets break it down. So there you can look at electron micrographs of the artery lining. And actually, they gave healthy young men high carb loads and imaged before and after. And within a few hours of a high carb load, you can see the glycocalyx break down. And then what's left is you have endothelium that's exposed. So if you have oxidized LDL, then it's going to get in between those cells and start plaque formation and a fatty streak. And there are products that can build with Raman sulfate that can build that glycocalyx back up. So I will use that a lot in patients that have soft plaque or higher calcium, abnormal calcium scores.
I'm still waiting for. Go ahead.
Oh, no, go on.
I was just going to say, I'm still waiting for someone to tell me that sugar has a green light, and it's just not happening. Gosh.
Although they handle it well. I think it's and everybody's so specific. That's why I think, dietary advice can't all be the same for everybody, because we know that ketogenic diets don't help everybody. I had a patient last week that I saw that, a woman that has a body fat of like 12%, and her hemoglobin A1C is 4.9, and I asked her if she eats low carb, and she's like, no. And
Yeah.
she didn't have any inflammation. Everything was perfect. And, she's just, part of it's probably lifestyle. And I think, we know that you don't necessarily need supplements in specific treatments. We learned that from like the Blue Zone data, that to me, lifestyle trumps everything. And every concierge company I've ever worked for hated me telling patients that, because they want to sell supplements and medicines and,
Sure.
compounded things. And I would always focus on lifestyle, because I said, the best thing you can do for longevity is, your nutrition, your lifestyle, your exercise, stress, all of that is going to trump everything else.
Curtis, do you want to ask some of your questions? You've got some good ones here. Oh, I think you're muted or we can't hear you.
Yeah, thank you. I
There
love
you go.
everything that you're sharing, Dr. Bove. And from my perspective, having 100 has been a real game changer. And I love all the new advances that are coming out. So before we wrap, I'd love for you to give us a sense for what's on the map for new things we're going to be able to see from 100 in the coming months. But specifically, I share Mark's sweet tooth. Can a continuous glucose monitor help know like how bad sweets are for us? Like, how can we know if like it's okay to have a little bit of chocolate, or maybe because my metabolism is so awesome, I can eat all the chocolate I want?
Absolutely. So I recommend those a lot on one-on-ones with patients, especially when things are discordant. So the hemoglobin A1C seems out of proportion to what they are reporting they're eating, and even tracking macros. So I always first will go to macro tracking, because I find that, there are vegetarians that think that they're low carb and they're carbitarians type thing. So I think everybody always doesn't, unless you've tracked yourself, you don't have a sense of, what 150 grams of protein is and how many carbs you're eating. Never. Unless you've done the experience once. And so I always have patients do that first, because sometimes that fixes things. But then if there's any question, then I think a glucose monitor can be huge, because it's going to show us individual response. So I may spike my glucose with sweet potatoes and not white rice, and you may be the opposite. So I think it's likely genetic based, but that everybody's different. So you can actually learn what things to avoid, or how to eat them and when to eat them. Maybe if you eat them, right after your exercise, your blood sugar doesn't spike. So I think that it can be a really powerful tool as your blood sugar spiking at night because of cortisol. So it can help us with lifestyle and sleep and all of that too.
Amazing, everyone. Well, thank you again, and for everyone in one of the our official Beusail forums. I mean, we're going to be kicking off next month. You've got that invite, and then for everyone who wants to join either that forum or another, we've got, like Curtis said, we've got a couple spots open, and then we have other groups that will be starting as well. So just make sure to reach out to the team, and we'll get you started. Thank you.
Cool.
Thank you.
Thanks for having me.
Thank you.
Take care.